What is the glycemic index for pancreatic health? Have you ever wondered how the foods you eat can affect your pancreas? The glycemic index, or GI, is a helpful tool to understand this relationship. The glycemic index ranks carbohydrate-containing foods based on how much they raise blood sugar levels after eating, compared to pure glucose. This ranking reflects the quality of carbohydrates and their impact on blood sugar and insulin releases, which is crucial for pancreatic health. For those concerned about pancreatic health, especially regarding conditions like pancreatic cancer, the glycemic index plays an important role. A diet that includes low glycemic index foods is generally seen as beneficial. Low GI foods lead to slower and smaller increases in blood sugar and insulin levels. This can help reduce the demand on the pancreas, which is essential for maintaining its function. Eating a low GI diet has been linked to several positive health outcomes. These include reduced body weight, lower levels of visceral fat, decreased inflammation, and improved metabolic markers such as blood lipids and blood pressure. All these factors can help lower the risk of pancreatic diseases, including pancreatitis and potentially pancreatic cancer, by easing stress on the pancreas and improving insulin sensitivity. However, it is important to note that current scientific research does not provide a definitive link between the overall glycemic index, or glycemic load, and the risk of pancreatic cancer. Large studies and meta-analyses have not shown a strong connection between high GI or high glycemic load diets and an increased incidence of pancreatic cancer. Some studies suggest that high GI diets may raise the risk in certain groups, like those who are overweight or sedentary, but these findings are not consistent enough to draw firm conclusions. To summarize, the glycemic index measures how quickly carbohydrate foods raise blood sugar and insulin levels. Following a low GI diet may support pancreatic health by minimizing insulin spikes, reducing body fat, and lowering inflammation. While some studies have linked high GI diets to an increased risk of various cancers, including pancreatic cancer, the evidence is not strong enough to confirm a direct relationship. Maintaining stable blood sugar and insulin levels through low GI foods is a sensible strategy for overall metabolic health and may indirectly benefit the pancreas. For practical applications, consider choosing carbohydrates with a low glycemic index, such as whole grains, legumes, non-starchy vegetables, and most fruits. At the same time, it is wise to limit high GI foods like white bread, sugary snacks, and processed carbohydrates. This approach not only helps keep blood sugar balanced but also reduces the workload on the pancreas, supporting overall metabolic well-being. Remember, individual health varies greatly, and personalized medical advice is essential. If you have concerns about your pancreatic health or cancer risk, consulting a healthcare provider is the best way to get tailored guidance.